I'm not kidding. This thing that had been around for so long that people knew nothing about was being resolved with this chiropractic adjustment. And the patient came into my office. She said to me, I've decided to have surgery. And I said to her, well, I don't think that that's going to fix your problem, but I totally understand that you want out of this pain. Before you jump to this, I want to examine you in a new way. I analyze people in the same way that I analyze a frozen shoulder for this lifting and rotation of the skull on the first cervical vertebra.
I don't see any reason why patients like James can't get better. At the very least, improve their quality of life while they have this disease. They don't have to become a cripple or invalid simply because they've been given this label that they have this disease. You should never become your disease, because in the moment you do, you're dead. Okay, bring your knee up, please. Let me have your arm up and locked right here. I'm gonna pull, resist, pull it. Okay, pull tight. You're a human being, vital, healthy human being, and I have this disease. And you work like mad to improve your lifestyle, your diet, your attitude, your spirituality, all those things that go into making up a completely balanced human being. We've gotten so far away from that medically. We are so out of touch. Instead of listening to our body's communication, we give it drugs to say, shut up, I don't want to hear it. We suppress it. Right there, you feel it? See how it weakens?
Yes.
This work maximizes function, maximizes performance. It predicts injuries before they happen. So many athletes, when they retire, their bodies are just all broken down, they're cripples. That doesn't have to be the case.
90-88. Front court left, Stockton falls down, and Stockton is hurt. He's hurt. His ankle. And trust me, he is hurt.
What's been shocking to me is just how fast the body's capable of healing. I mean, this body is an amazing system, and we're just barely scratching the surface of what's possible.
Not everybody has that treatment. Not everybody can be kept balanced like you kept me balanced. So things didn't have a chance to grate and wear down and erode. If something bad happened, like the sprained ankle, I didn't have to adapt around it. We got it back online, and I could play not only pain-free, but free from the worry that I was going to hurt myself worse.
I know you fought some battles for me.
Yeah, because I was committed to the treatment. And I thought everybody should be committed to the treatment. I mean, this works. If something works, why aren't we pushing it? Why aren't we pushing it?
And my position has always been that I trust the proprioceptive system, the nervous system. Once we reset the joint, reactivate the muscles, walking and running becomes therapeutic. And we saw that numerous times through your career.
That might be the greatest service that really you did for all of us, because you know where your body's going. You have control of your body. And I think you'll survive even the most rigorous seasons.
Okay, Peekaboo has got to take advantage of her smooth course now. Her powerful German rivals, led by Katja Zeisinger, purposely chose later start numbers, assuming the track would speed up. And they're also counting on course.
As an athlete, you rely on your body for everything. It becomes your means, it's your vehicle. I can remember when I first met Dr. Bueller, I found out that so much stuff was shut down and I had so many imbalances.
I'm gonna pull and you resist, pull tight. Pull it, nice.
I had some really profound adjustments and some really amazing experiences with him, and I knew I could then go out and actually legitimately ask of my body to give me an Olympic performance.
Gate you went by, Peekaboo straight into the lead.
The neatest thing is when you see a patient who has given up and they realize they can be better and actually start to cry. That's powerful. And it doesn't get any better than that.
I'd been suffering from major knee pain. I broke my right leg, had a rod inserted. Nothing was working. Basically, I was skiing on one leg all year long. I came in just with the attitude of anything could help, because I love it. I love skiing. I was in so much pain, and then I got worked on by you. I got off the table and instantly pain-free. It was pretty amazing.
It frustrates me to no end when I'm ostracized by the medical profession, where they look down their noses at me, where they tell people that I'm a quack or that the only reason I get results is because it's placebo, which means the patient believes they're going to get better, they get better.
I limped into your office to get adjusted before a road trip, and you asked me about the ankle. I said, well, what's going on? I said, don't worry about it. It's tendonitis. It's under control. We're handling it. And you said, well, you mind if I touch? I said, you can try to touch it, but you can't. You're not able to find anything. You can't palpate it because nobody else could.
And you asked me if you had to believe in it for it to work. Remember that?
Yeah.
I said no.
Yeah. If this was faith healing, we were in deep
That's
trouble because
true.
I wasn't a believer.
That's true.
For sure.
Stockton, open three. John Stockton sends the Utah Jazz to the NBA Finals.
I've been called a quack. I've been called a charlatan. I've been told I diagnose things that don't exist, that I treat conditions that I shouldn't be treating, that I'm a liability to patients. As a chiropractic physician, I've spent my entire career fighting for the right to practice. We are up against the most powerful lobbies there are, the medical profession, the pharmaceuticals. And consistently, we're fighting to prevent legislation to carve us out of insurance, reimbursement. It gets exhausting, but right now we are fighting for our very survival as a profession.
As a medical student, I don't think I really ever heard chiropractic medicine come up ever in my formal medical training. And I really didn't know what to think of it. In general, they just sounded to be high risk and unestablished.
Many people have said, I don't go to a chiropractor because I'm afraid. I've heard that maybe chiropractors cause stroke. The research does not say that whatsoever. What they determined after looking at these thousands of cases is that an individual is no more likely to suffer a stroke after a chiropractic visit than they are after a medical visit.
What we do now know is that people who have the pathology, which is called a dissection, in the arteries in the neck, you develop neck pain because the artery is separating. That inevitably leads to a stroke, and it doesn't matter whose office you go into. Because like somebody who has a heart attack, you can be feeling great, you develop some arm pain. The process is the same, and it's just as devastating, except when you get a heart attack, you haven't got anybody to blame.
Medicare is the largest healthcare system, and in general, people are very satisfied with it. Our seniors go to their doctors, and they're covered for most conditions. And with chiropractic being a more natural approach to care, many seniors would like to start there first. The problem is that with Medicare, they only cover 3 codes for doctors of chiropractic out of 10,000. That means the patient is limited by what they can get reimbursed for. The insurance industry is often run by medical physicians. So the payment scheme that they've developed tends to go towards that direction. It doesn't really make anyone a lot of money if a patient can go to a doctor of chiropractic, get some naturally based treatment such as an adjustment, some nutritional advice, and talk about exercise. There's not a lot of money in that, but it's awfully good for the patient.
We look at someone from head to toe, not only what their pathology is, if areas have been injured, but what their functional integrity is. It comes back to observations that were made over 100 years ago, where neurological function was increased without using drugs or surgery, specifically by an adjustment. Since that time, it has been known that the consequence of chiropractic applications have been based on the nervous system. We really didn't understand the brain over the last 100 years as much as we understand it today.
When you start looking at the brain, your treatment protocols radically change. We were taught to use certain anti-anxiety medications like Valium and Xanax. But as soon as I started scanning people, I stopped using them because I saw that Valium and Xanax and medications like that pretty much work like alcohol in the brain. And over time, they cause suppression of brain activity. And I go, ooh, I'm making people worse. See, if you don't look at the brain, you have no accountability for making your patients worse. Psychiatry is broken. Psychiatrists make more money if they see 4 people in an hour. So it's become 4, 6 people in an hour. Here's the medicine. What are your side effects? Does it work? Let's try this. Okay, I'll see you back for $175 for 15 minutes in a month.
Our time is up.
Okay.
It's crazy. It is just a total crazy mess. In order to really make proper diagnosis, you need to understand their biology and their psychology, how they get along with other people, what's the social situation in, what are their spiritual beliefs, not necessarily religious, but why do they care? What does their life mean? And when you treat them, again, in a biological, psychological, social, spiritual way. 85% of psychiatric medications are prescribed by non-psychiatric physicians, your family doctor, or your OBGYN, or your internist, and I actually think they don't do a very good job. The problem with medicine is we make symptoms, depression, diagnoses. When you do that with depression, you dishonor it, because depression's a symptom. It's got many different causes, and you end up giving a one treatment fits everybody approach, and it's really no better than placebo. But that's what we do in psychiatry, and it hurts people.
We want to just have you stand up. We're going to get your blood pressure and your pulse rate standing up. We'll see what happens. Medical doctors, they're not putting their hands on patients. I think that that's really lacking in medicine. They go through so many rotations. They kind of become desensitized. We attract patients that have been basically, I don't know if chewed up by the medical system is the right way to describe that, or the fact that they've exhausted everything in the medical system. I had a patient fly out from New York, basically on the verge of suicide.
The last 2.5 years I've been full of pain. If it's not my head, it's my knee. If it's not my back, it's something else. It travels, it moves. It messes with my heart, it messes with my head, and most of all, it's gotten to the point where it's beating my soul up.
I'll say it till I die, and hopefully that's not tomorrow. I feel worse now than I did 2.5 years ago when I started seeing, I'm told, some of the best people in the business. I can't get a straight answer at anybody. One medication does one thing while another does something else. Combined, they do nothing. And ultimately, my quality of life, doctor, is to the point where I cannot live this way. I want to do something about it. I want my life back.
I say you're on a couple different medicines, Lyrica, Ambien, OxyContin, etc. Besides giving you prescription therapy, is there any other plan moving forward?
The one plan moving forward that my consortium of doctors is suggesting, in fact, trying to ram down my throat at this point, is spinal fusion. They're convinced that my problems start and end there.
The medical profession looks from a pathoanatomical point of view when they look at an X-ray and MRI. In other words, they want to see something wrong with the anatomy. That's why they can find a degenerated or abnormal herniated disc and say, there, right there, I can prove it to you. See on this X-ray MRI? And they'll do their fusion. But what do? They fuse you in a misaligned position. Your physiology, your functioning has not improved whatsoever. Failed back surgery is so prevalent now that the insurance has its own code, failed back surgery syndrome. What they're doing is just drugging them, shooting them, cutting them, and then we see the after effects. I had a man come into my office the other day who had 8 back surgeries. He didn't need one of them. 50 to 90% of back surgeries fail according to medical men themselves.
But I had a dream where I woke up in cold sweats and I was in hell. All the people there with me in hell were all the patients that received surgical procedures from me that didn't really need it, and their lives were destroyed because of it. Every time I go into the operating room, it's uncomfortable in many ways because you're turning the patient's lives upside down, and you're worried, is this going to really provide the relief for this patient that we've hoped for?
There is an epidemic of back pain. It's a billion-dollar issue. We wind up with people not being able to function. They get depressed. They get hooked on pain medications, of which are freely available. If there had been proper, organized, coordinated intervention, an integrated kind of an approach to that person may have saved that individual from what I consider to be a life of despair.
I agree with you. I think a large percentage of those patients would have been helped by earlier intervention, a more holistic approach as far as diet, exercise.
We have patients that have absolutely no benefit from the surgery we provide. Some patients have complications and their outcomes are worse.
James, in every possible way, has helped me because he's done everything the polar opposite of me. Every time I turn around, another doctor is throwing yet another painkiller at me, and I'm only too glad to oblige.
The patients want the shortest route to the quickest fix, which is a pill. A lot of physicians want the shortest route to the quickest fix, which is to get them a prescription, get them out, and get the next patient in. And that's where the trouble begins.
He's hopefully going to support me through the next phase, which is my detox, and frankly, I'm very nervous about it, but on the other hand, I know that in order to get to where you guys want me to be, I need to go through that phase.
Is this the first time you've ever done a detox?
Oh, yeah.
Purdue Pharma, the company who puts this drug, OxyContin, into the marketplace, pleads guilty that they misrepresented the addictive aspects of this drug. They said that it was less addictive than other drugs already on the market, where it turns out it's more. They pay a $600 million fine, but when you look at the amount of money they've made on this, it's astronomical. And here's a drug that now took people who had back pain, a manageable problem. They get put on this drug to try to control that problem, and next thing you know, they substitute their back pain for a drug addiction.
And James, what was different for your experience about how you went about treating it or addressing your own health than what Brian had gone through?
When I was diagnosed, it took about a year to come up with a diagnosis. My neurologist gave me the different drug options, and I didn't want to get on them.
I almost feel guilty of having not been that person that he was, who obviously had some sort of fortitude and brass that made him say, no, I'm not going there. Whereas me, I'm like, what do you got? Okay, bring it on, I'll take it. I feel on a certain level ostracized because I'm, let's face it, a junkie, which a week from now I'm going to address. I don't expect the detox to go smoothly.
We face a tremendous dilemma looking at chronic pain as a major social medical problem in this country. We have to do something for patients who are suffering. We want to keep our population functional. Opioid drugs are a potential tool. There are people who can use these drugs, go back to work, have good family lives, the whole thing. But we don't know who they are. We haven't a clue. It's just a matter of luck in prescribing. In no other country in the world is this going on.
The process for Brian is going to be long-term. It's not just pain that we're dealing with here. We're dealing with a lot of emotions. One of them is denial. The other one's guilt and anger.
Here's my deal. I am starting to think I've already lost the battle. My self-esteem, which is pretty much a floor mat anyway, is now lower because why? Because I came here to get off everything. That's not gonna happen. I'm gonna walk out of here, at best, an OxyContin freak. I'm aware of it, okay? But
I think he's aware that he's a drug addict and he's on a lot of medications that he shouldn't be on. It happened by accident. You know what? If you're in pain, you take a medication, you feel the medication is not working for you, so you need a stronger dose, you end up on 3 or 4 drugs before you know it. It grows to that point very fast.
I'm not passing the buck, people. I'm culpable, but I'm not fully to blame.
The number of overdoses that we see in this country now from opiate narcotics supersedes all other overdose deaths from illegal narcotics combined. The drug abuser today is not going to be poorly bathed and pull up to my ER in a shopping cart with flies all over the place. They're going to look like you and me. And the lay public does not understand that. They don't understand addiction. Most physicians don't understand addiction.
The influence that the pharmaceutical industry has on healthcare in general is all-inclusive. They have their hands in every aspect of healthcare, and they have their agenda being promoted through every level of healthcare. You're talking about very deep pockets, and you're talking about very highly politically active companies.
Merck is invading the planet. They are everywhere, buying off politicians and pushing their dangerous cancer virus vaccine that's been proven that 18,000 plus people have had adverse reactions, autoimmune diseases, and even death.
A big pharmaceutical company like Merck, like GlaxoSmithKline, like Pfizer, all of whom have been sued for billions of dollars, paid all these billions of dollars of fines, which become the cost of doing business for them, basically. The government could go in there and say, we're cutting you out of our programs. We're cutting you out of our Medicare program. We're cutting you out of Medicaid. But they won't do it because they need the other drugs they have. It's literally another form of addiction that they have. But the consequence of all this is that people are dying.
The last time I checked, we're the most sophisticated healthcare system on the planet. So is this really a public health problem, or is this a Wall Street growth initiative? And the truth of the matter is it's probably both.
The Justice Department and our law enforcement partners have reached an historic $3 billion resolution with the pharmaceutical manufacturer GlaxoSmithKline.
GSK's sales force bribed physicians to prescribe GSK products using every imaginable form of high-priced entertainment.
This action constitutes the largest health care settlement in United States history.
Now, to you and I, $3 billion sounds like an enormous amount of money, and quite frankly, it is. But when you compare that to the profits of the drugs that GlaxoSmithKline were fined for as far as their practices, it's a cost of doing business at that point, but lives are lost in the meantime. I mean, people are dying. Nobody goes to jail.
As a pharmaceutical rep, I had a six-figure salary before I was 30 years old. I had a company car. I had a stock portfolio. I don't have any of those things now. Now I have a bunch of karma to reverse. Now I have a conscience issue that I have to deal with.
Our beautiful little girl, Candace, died by hanging 4 days after ingesting 100 milligrams of Zoloft.
Found Jacob hanging from the rafter in our attic. It wasn't the disease that caused my daughter to viciously mutilate herself. It was the drug.
These parents believe the drug companies had evidence there was a risk, but never told them.
They weren't given good information. They had no idea that they were taking a risk that this child would go into their room and hang themselves. They were 7 years old. How many 7-year-olds hang themselves? They don't if they're not on these drugs.
The whole game is rigged. Vioxx, put out by Merck, killed more people than U.S. soldiers that died in the Vietnam War. They are smart enough to understand the implication of their actions. They're smart enough to understand that they can be destroying families, that they can literally be killing people. What kind of a human being does that? It's one thing when people make a mistake. It's another thing when it's volitional.
Well, the economics of a drug company are pretty basic. They're a corporation put together to make a profit for the investors. But if a drug company came up with a product that would cure a problem, every time they treated someone, they would lose part of their market because that person would not have to come back. They would not be able to make a profit. They don't want anyone else to have it, so they would hide it.
One of the things that I was trained to do when I worked with Bristol Myers Squibb was how to psychologically profile a physician in order to know how to approach that physician and best influence their prescribing habits. I very often would know better what a doctor's prescribing habits were than the doctor himself. So the way that I was very effective and the way that most reps today are very effective is simply through bribing physicians through the things that they like.
It was not uncommon for me to be chauffeur-driven around in a limousine, flown in on a private jet, name my price, and stay at the top of the Four Seasons. That happened.
What doctors should be aware of, and what I'd like psychiatrists in particular to be aware of, the pharmaceutical industry doesn't have any respect for you. Behind closed doors, they're talking about which drug whore to get to promote their products. And that's what they're calling doctors. They have no respect for their whores, no matter how much they pay them.
If physicians are following guidelines, and that always means prescribing medications, we get more money. So we're talking about a major incentive to just get that prescription written and just convince people to take their pills, no matter how lousy it makes them feel.
Many times patients do come in asking us or telling us what it is they feel that they need. And oftentimes those medications come with a substantial side effect profile or the potential to create addiction. So as a physician, we're no longer really physicians, we're providers. And our patients are really no longer patients, they're subject enrollees in a third-party healthcare system which has a legitimate stake in how we as physicians spend their money. The way we solve their problem in the short run is through the prescription. And while that may be indeed a quick fix and a happy customer, we can't assume that our patients understand the concept of downright addiction. They understand that I give them a pill, they feel good, and their pain goes away, without necessarily understanding the longer-term repercussions. The central tenet of the physician-patient relationship is trust. And if that trust is breached, then we have a real problem on our hands. And we're starting to see that now.
We get brainwashed, and we come to believe that things like chiropractor and naturopathy and acupuncture is all quackery. As physicians, we have become basically indentured servants to the medical insurance industry and prostitutes for the pharmaceutical industry without even realizing it or thinking about it. And you cannot see a person for 5 minutes or even 10 minutes or even 15 and just hand out a pill and expect them to get better when, you know, really their depression is caused because they have, you know, a husband who's lost their job and a son who's in crisis and they're working 2 different jobs and not sleeping. That's the underlying issue. It's not a deficit of Prozac.
Children are the largest expansion market available to the pharmaceutical industry, bar none. Children have nowhere to go. They don't know how to put into words, they don't know how to communicate the side effects that they're experiencing. They don't know to relate them to the drugs. Their behavior escalates, or their maladaptive behaviors escalate, and they get more drugs added to them, or they get the dose increased, and then they become delusional and they hallucinate, and all kinds of things happen to them, and they don't even know how to articulate it to their caretakers. It becomes an add-on business technique to sell more drugs and to have lifelong customer bases. All kiddos have health insurance. They're either covered by private insurance or they're covered by Medicaid. So therefore you have a guaranteed reimbursement in terms of insurance, and you have a refill, a guaranteed refill consumer, because the doctors are going to encourage the patients to refill their prescriptions. The parents are going to make them refill their prescriptions. So this is a marketing ploy in trying to get our children on drugs, because they have recognized that not only are they all covered by insurance, but they're lifelong customers if they can get them on drugs at an early age.
Utah's Division of Child and Family Services once tried to force the parents of a boy named Parker Jensen to have him undergo chemotherapy for Ewing sarcoma. That polarizing